Hey, I'm Dr. Gardner, and tonight I wanted to talk to you about tracheal collapse. It's something that we diagnose very frequently, primarily in smaller breed dogs, and usually they come in because they are coughing, and that is how it is diagnosed once we take x-rays and do some other diagnostics. And first I want to talk about what it is. So tracheal collapse is when the trachea, which is our windpipe, air in and out, actually the cartilage rings, which keep it open, become weakened, and so the lumen will actually collapse, and that obviously affects air movement through that passage, and that can result in coughing and irritation, and in very extreme cases, if they don't get enough oxygen, it can result in them turning blue. So that is what tracheal collapse is. It is a progressive disease, so we can't cure it and we can't reverse it, but we can help them with the symptoms. And so I'm going to talk about some of the things that we can do to help them. Tracheal collapse can be something that affects the upper airway, so the cervical, or also the thoracic, or both. And it can be exacerbated by several things. The first one is being overweight. That can make the symptoms worse. The second one is lower airway disease, something like asthma or something infectious. Dental disease and cardiomegaly, which is an enlarged heart, can also contribute. And then if there's any other concurrent respiratory issue, or if you have a dog that has laryngeal paralysis, or if you have a dog that is a brachiocephalic breed, the super cute ones with the smushed noses like Frenchies, that can make the symptoms a little bit worse if they already have respiratory issues, which they're prone to. The cough associated with tracheal collapse tends to sound like a goose honking noise, but it does depend. Some of the dogs don't sound quite like that, or it's described in different ways. I'm going to show you a video of two dogs that are having a tracheal collapse episode right now. So how do we diagnose tracheal collapse? Well, certainly you would head to your veterinarian and have a conversation. They would do a physical exam, but we do typically do chest x-rays. And I would definitely recommend that because you want to look at the health of the heart and the lungs at the same time to rule out any other concurrent diseases. And also you can see part of the trachea. And sometimes if you catch the film just right, you can actually see the tracheal collapse. And that is a pretty good definitive way of diagnosing it. So that's definitely something that they would recommend. And then whatever else they might want to test for depending on the physical exam and if your dog has anything else going on. And then how do you treat it? So in Western medicine, we would typically start with antitussives, so things to make them stop the cough. And a lot of times that's hydrocodone. We would use sedatives or things to calm them down because we want to prevent them from going into those fits of coughing where they have difficulty breathing. So that's another thing we would use. Sometimes we'll use bronchodilators, so that's something that opens up the airway, so it helps them to breathe better. And then in some cases we'll use steroids, in some cases we'll use antibiotics. That's typically if there's something else going on top of the tracheal collapse, but that's kind of the list of things and how we would approach it. I also will recommend that people use a HEPA filter in their house, and so that improves the air quality. And then I'll also recommend using a harness instead of a collar, like I said earlier. And then slippery elm and honey can be great for a cough, so I would recommend that. I also think omega fatty acids are fantastic for general inflammation, so that can be really helpful. Then some dogs that have tracheal collapse also have acid reflux, and that can cause coughing and then send them into a fit. So I think that probiotics can be really helpful to get the gut flora healthy to reduce any acid reflux. So probiotics are a great addition. And then I do like cartilage support. So you can do a supplement designed specifically for dogs that supports cartilage growth because of the cartilaginous rings that support the trachea. And then the last thing I recommend is that they moisten the food, and that helps reduce any powder or dust when they're eating, which can also create a problem. So those are some of the things to consider at home if your dog is diagnosed with tracheal collapse. One final thing that I will say is that in extreme cases, sometimes they'll place a stent, and that can sometimes be helpful and sometimes not, but it tends to be in later stages in more extreme cases. So I hope that you find that information helpful. I welcome any questions or comments. I would love to hear from you. And if there's any particular topic that you would like me to talk about, I hope that you will like and subscribe, and I will see you next time.